senior personnel from the USNS Mercy mission. The Mercy is currently in Cambodia, wrapping up its 4-country mission this year that included 10 partner nations from around the Asia-Pacific region. We have with us this morning Captain Tim Hinman, the commander of Medical Treatment Facility Mercy and Mission Senior Medical Officer, Commander Matthew Provencher, medical doctor from the U.S. Navy Director of Surgical Services, and Dr. Stephanie Garlichs, veterinarian from the World Vets, a non-governmental organization that has been participating in the mission. We may have others joining us in the next few minutes, but we'd like to go ahead and get started. Is Commander Lohmeyer on the line? Unmute.
Hi, Paul. This is Maria Lohmeyer.
Okay, great. You want to go ahead and get started?
Sure. Good morning. I just want to say thank you to the East. Thank you. I just want to say thank you to the East Asia and Pacific Community Bureau for this opportunity, and for our journalists who are dialing in. Just to give you a quick, broad overview of the mission and some of the numbers that we've got, so we can focus on the substance with our guests. Excuse me. As Paul mentioned, Pacific Partnership is the largest annual humanitarian civic assistance project in the Asia Pacific. We're now in our 7th year. We've traveled to Indonesia, to the Philippines, to Vietnam, and we're finishing up here in Cambodia. For some of the numbers, we will have traveled when we return to San Diego in mid-September, which is the final stop of our mission, 20,595 nautical miles. That's over 20,500 nautical miles with the USNS Mercy. We will have completed over 50,000 medical evaluations in remote medical clinics. That include medical and dental care. We will have completed over 850 surgeries aboard the USNS Mercy. Excuse me. And we will have treated or evaluated over 7,500 animals. And Dr. Garlichs will talk about why the veterinary piece is so important. So I'm going to turn it over now. In addition to the 3 guests that we have, pardon me, I'm dealing with a cold this morning. In addition to our 3 guests, we are honored to have our mission commander, Commodore James Morgan, who is the mission commander for Pacific Partnership 2012. He is also the leader of DESROM 7 back in San Diego, which oversees 6 different U.S. Navy vessels. We also have Lieutenant Nigel of the Australian Defence Force, and he's our primary engineer who's been working on the ground with the various militaries and skilled workers. So I'm going to start off with Captain Morgan. Each one will have about 1 minute just to give a bit of primary overview of their role. And then once we get through our 5 guests, we can launch into questions. Captain Morgan?
Good morning. I'd also like to pass on my thanks to the East Asia Media Hub for hosting this roundtable today. It's been a great mission. In my capacity as the mission commander, I'm overall responsible for the completion of the mission. Myself and my staff were responsible for coordinating all the different organizations that would be participating in the mission this year, including partner nations, non-governmental organizations, and the military. We had a lot of help from the Pacific Fleet staff at the beginning of the mission planning evolution, but for the mission itself, the completion of the mission and the different activities in each country were a collaboration of my staff and all the different organizations that took place in this. First, I'd like to always thank you to the host nation for inviting us to take part in the mission. We are invited by the host nations to take part in Pacific Partnership, and our primary mission is to build capacity and build stronger relations with various nations, with the end goal being to be prepared for deal with humanitarian and disaster relief situations. In closing, on that note, I was took part in the tsunami relief efforts off of Japan in March 2011. I can tell you that missions such as this are critical in building the relationships to quickly respond to those natural disasters. And it's not really an if, but when these disasters will happen. So once again, I'd like to say thank you very much for hosting this media hub, and I will pass it back to Maria.
Thank you, sir. Dr. Hinman, if you're on the line, I believe you need to dial 91, but if you would go ahead and introduce yourself and then followed by Commander Provencher. Over.
Actually, he's on, Maria. He can go ahead and speak free.
Oh, okay.
Yes. Good morning. This is Captain Tim Hinman. I am the commanding officer of Medical Treatment Facility, USNS Mercy. For purposes of Pacific Partnership, I am responsible for all medical operations and activities that occur on the ship and off the ship. Additionally, I have a staff for Pacific Partnership, which averages, it changes from day to day depending on which country we're in, but it averages about 850 dedicated men and women who are medical professionals. They will include NGOs, partner nations, and of course military. So an eclectic group, very well dedicated and compassionate individuals as we execute medical missions. I have been in the Navy 25 years. I'm an emergency physician and have been attached to Mercy as the commanding officer of the hospital for about 20 years. I'll turn this over to my Director of Surgical Services, Dr. Provencher, to give his introduction.
Morning, everyone. My name is Commander Matthew Provencher. I am a orthopedic surgeon, a shoulder, knee, and sports surgeon by trade in my useful job in the United States Navy for the last 20 years in San Diego, California, at one of our large military treatment facilities where we take care of young men and women and their family members. This mission for me is my second mission. I came out in 2010, and I'm back out here in 2012, willingly and gladly, and now serving in my role as Director of Surgical Services. In this role as Director of Surgical Services, it's my responsibility to coordinate all the surgical, dental, optometry, and eye care on the mission. I have approximately 280 people, which again fluctuates depending on the mission site, of surgeons, nurses, dentists from all over the world, from different host nations, partner nations, as well as NGOs that come together under one roof on this Mercy mission to accomplish the medical surgical portion.
Thank you, Commander Provencher. I'm going to turn it over to Lieutenant Hinde to talk about engineering.
Good morning, everyone. My name is Lieutenant Hinde. I'm the Australian engineer as part of this mission. We have sent an Australian contingent of 12 people on this mission and have joined up with the American Seabees throughout the whole Pacific region. We've completed a number of buildings, and we've seen these buildings rise up. Most of them have been medical buildings and some educational classrooms. We have watched these and I've watched and helped manage and coordinate these construction sites. We've worked with host nation engineers, both military and civil. It has been a great opportunity for our people to come together, each nation, to construct a building at each different site.
Thank you. And Dr. Garlichs, can you please introduce yourself?
Yeah. Hello, I'm Stephanie Garlichs. I'm a veterinarian from the United States, and I'm representing World Vet, which is an American NGO, an organization that sends volunteer veterinarians all over the world. We work in 34 different countries so far. Our team includes 8 people on the Mercy. There's 5 veterinarians, 2 veterinary technicians, and 1 photojournalist. We have in these 4 countries, we've been working with all species, really, cattle, pigs, chickens, ducks, dogs, cats, even monkeys on occasion.
Paul, if you'd like to turn it over for the question and answer.
Thank you. We'll open it up now. I believe we have on the line GG Media from Japan, a large wire service, digital media. So if you have any questions, please press 9-1, and that will allow you to speak, and then we can unmute you and you can ask your questions. Okay?
Thank you. This is Akshay from Garlichs. My question is, what was the biggest hardship that you had to overcome in the 7 years of your mission? Thank you.
Paul, can you repeat what was the biggest over the 7 years of the mission?
The question was, what was the biggest hardship you've had to overcome over the 7 years of the mission and in gaining access and cooperation to different countries?
This is Captain Morgan. I could take that on. Like many things that we have to deal with, we have the time and distance. We call it the tyranny of distance. Is certainly something we have to deal with. Mercy is home base in San Diego, so we spent a good part of the first part of the mission, just getting to the different countries, and that's just the price of doing business a little bit. The second thing is Mercy comes together with very broad organizations, our partner nations, our NGOs, roughly about a month before the mission deploys, and we continue to add capacity, NGOs, partner nations, all the way up until the first mission port. So that being said, I would say that that's not really a hardship, that is just sort of the price of doing business, but in the end, we spend a great deal of time getting to know each other, focusing on the different aspects of each mission. And then, of course, each country has its own subtle nuances, differences, and so forth. And those countries come one after the other. I think we do about 56 mission days, 14 days in each country, out of about 70 days total, because we don't spend a lot of time transiting between the mission countries. So we rapidly move from the requirements that we execute in Indonesia, then we move on to the other 3 countries, and there's just not a lot of time.
Did anyone else want to follow up on that question from GG Press?
This is Captain Hinman. Can you hear me?
Yes, we can, Captain.
Okay. I'd just like to comment that, like what Captain Morgan said, I think over the years this mission has existed, it's been a continuing evolution. I think one of the things that we have been trying to build is capacity and sustainment over time. And that takes a lot of planning. It takes a lot to understand the host nations that we're going into and trying to develop activities which will be sustainable and more than just a 2-week visit to that country. And I think some of what we're doing in this mission is particularly valuable if you look at what some of the work our surgeons are doing off the ship and collaborating, building relationships, and engaging in activities that previously had not been fully explored. So the surgeries off the ship, the linking with academic institutions is really building that sustainability piece. Over.
If I could just add, this is Commander Provencher, Surgical Service Director. What I think that is very unique about this mission, although we have changing faces that come on board the ship every few weeks, it's putting this team together and forming this team to work as one under the roof of a medical partnership. What is even better about it is we have the best that the Navy, the U.S. military, NGOs, and also the host nation has to offer. And we have this on the mission to really provide compassionate and dedicated care. this was a testament or chief brought about on this and also requested by the host nation to work hand in hand to learn from each other. And I think that's really where this mission is evolving and very exciting about where this is going in the future in terms of providing these educational and almost what we would call mini fellowship type of experiences where we can work, although it's 2 weeks potentially in each country, we can work very closely hand in hand with each other and our host nation surgeons to really provide an incredible education, long-lasting benefit.
I think we have another question on the line.
So this mission is clearly leading up to a long commitment and long lasting relationship with your partnering countries. But at the same time, you must have witnessed a shortage of supplies or a low level of techniques in medical terms in some of the countries that you visited.
Dr. Hinman, do you want to take that?
Yeah, if I understand the question correctly, it's getting at some differences between how we might approach care in the United States versus or Australia or one of the other countries that's visiting us, and the countries that we visit. And I think that this really represents one of the unique opportunities and qualities of this mission is that we learn from our host nation in certain cases on how they approach a particular medical problem, and we learn from each other in that setting. I know in Indonesia, for instance, pre-planning with one of our ophthalmologists, Dr. Jar said, there was concern about doing cataract surgery in the islands of Indonesia if we were to plan on doing them off the ship. And in many cases, some lower technology solutions that provide effective sterilization techniques, this sort of thing, was brought to our attention. At the same time, like what Dr. Provencher was talking about, we experienced very capable physicians and surgeons in Vietnam who maybe didn't have the cutting-edge equipment that we did. And we were astounded with the techniques that we were able to work with them on certain cases, and also in a position to teach as well. Dr. Provencher, did you have anything to add?
No, I think that's exactly it, is that we're collaborating and learning from each other. And a great example is from Manado, Indonesia, where we had 60 ophthalmologists, including several of the ophthalmology leaders in Jakarta, Indonesia, fly out to see us, the president of the Ophthalmology Association. And what's unique about this area in terms of eye surgery is that the cataracts are so very dense and so hard because our patients are living at the equator and get exposed to a lot of sun. So even though our cataract surgeons are absolutely phenomenal on this mission, they call these cataract difficulties a 12 in difficulty on a scale of 10, 1 to 10. So very challenging cataracts. But here's an example of our host nation that sees these cataracts all the time in Manado, Indonesia, and Jakarta, flew out a team of experts to work side by side with us to build each other's capacity and take care of these extremely challenging cataract cases. And that was great. That was the first part of the mission for us, and really built that team effort to help take care of these cataracts in a very meaningful and impactful fashion.
This is Paul Watts-Roberts from the Hub again. I believe we have AP on the line as well. If you have a question from AP, please press 9-1 for access to the conversation. And I wanted to ask the medical personnel, I know you went to 4 countries this year, Indonesia, Vietnam, Philippines, and Cambodia, but you also had 6 other partner nations from the region, Australia, New Zealand, South Korea, Malaysia, Singapore, and Japan participating with you. Could you talk a little bit to what those partner nations bring to the overall mission in terms of capacity, skills, and ability to bridge some of the cultures in the region?
Yeah, absolutely. This is Captain Hinman. They're vital in our partnership building in this particular mission. They bring tremendous capacity and skill sets. I would say that everybody who volunteers for this particular mission, whether in the U.S. Navy or one of our partner nations, come from the top of their class. They're really state-of-the-art individuals that bring very good skill sets. A couple people come to mind, and I'm sure Dr. Provencher will have some more examples, but Australia has been with us throughout the mission. Again, top people, good people to work with. We've bonded, we've come together. We were side by side in the OR or the wards, or at the MedCap, the DenCap sites as well. But there was an individual who helped us significantly on the case that Dr. Provencher described. He was a partner nation Australian, Dr. McHugh, on reconstruction techniques for the child that had the meningeal defect in Manado. That comes to mind. Just currently in Cambodia, we've got a nationally respected pediatric surgeon from Emory University, from one of the NGOs, Project Hope, and we're learning a lot from him. He's melded great in the week that he's been here. That's a fantastic experience for our team. And the stories go on and on about the interactions. Dr. Provencher, do you have more that you can tell about the capabilities of our partner nations?
Right. First of all, there's no question we can't do this alone. We need our NGOs, we need our partner nations to help build capacity and really respond to the eventual crisis in the future. And that's what we're training for. We're preparing in this sort of calm environment, although what is somewhat a realistic environment. And by bringing these experts, and I said it before, but we really do have the best of what our U.S. military, NGOs, and partner nations have to offer on this ship. And it really brings a level of expertise, not just to those that are running on our ship, but also in the country. We had a general from anesthesia that ran our anesthesiology service and was doing some of the most cutting-edge regional anesthetics in order to minimize post-operative pain. We had patients on our ship that would not take narcotic or other pain medications after surgery because they frankly didn't need it, because the blocks provided by one of our partner nations, that's a regional block before surgery, was that effective, so good and cutting edge. Well, not only was he doing it for the patients, but he was also teaching the host nation anesthesiologists that were on board with us. And so that's what we're trying to do here, is really grow this tree of this mission and almost a mini fellowship in all these different specialties for really improving our host nation capacity and capabilities.
Paul, I think Dr. Garlichs might also have some perspective from the NGO and working with other nations.
Yeah, I just wanted to say that as far as World Vet is concerned, on our team of 8, we had a veterinarian from Denmark, one from Scotland, one from the United Kingdom, and several from the United States, all of which have worked in a variety of other countries before, in quite a few developing nations. So that has been an interesting perspective to bring the different regions together that way. Also, in terms of the minimal supplies, I wanted to add that we have a lot of questions about that in Vietnam and Cambodia. What medication would you use for this disease or that disease? Many of the medications were not available in the country. So we did a lot of training in physical exam and management. If you can manage cattle in their home environment, if you can help the farmers feed them better, reduce the stress, then you're going to have fewer diseases and need less medication.
Excellent. Thank you, doctors. I'm going to open it back up one more time for questions. Gigi Press, did you have anything else that you wanted to ask this morning?
I have 2 questions. Has religion ever stood in your way when you were trying to operate in countries? And in contrast to the first question I had, what was the best experience throughout your operations? Thank you.
So this is Captain Hinman. On the religion question, quite honestly, we have 4 chaplains with us on this particular mission, and they've been fantastic about providing us guidance and traversing those religious type questions. It really hasn't come up with the places that we visited. But we were prepared for the differences in religious practices for the areas that we were visiting. The other aspect about that is that we try heavily to engage the host nation, our counterparts, and recognize those hurdles before we encounter them and help us bridge them when we do as well. So religion hasn't been an issue on this ship, and I think culturally we've learned a lot from the places that we have visited, including the religions of the people that we have visited. The next question was on best experience, and I think this is an individual question that each and every person will have something to offer. Every single person I have in my command, I think, tells me stories every single day. For me, I think it's a little hard to put into words, but it came to play when, again, on one of the first MedCAC or medical care sites that I was participating in Indonesia. And I was struck by and humbled, quite honestly. I think that's an accurate description of the generosity, the openness, and thankfulness of the patients that I saw that day. And despite the fact that in many instances I could do a history and a physical exam and provide some limited care, they were overly gracious, and their thankfulness was truly overwhelmed me. I think that it certainly gives you pause to think on the countries that we visit and the priorities. I think that each country, you start to realize that the patients before you, we have more in common than we have differences amongst them. And the differences are very special and defining for these cultures that we visit. But I think as a whole, it struck me to reconsider what's important for me in my life, and that includes, as I've witnessed in these countries, the bonds of friendship, family, and community. Dr. Provencher, did you have any special experiences?
There were so many special experiences, it's hard to really recount one. I think that's the beauty of this mission, is seeing the group come together. And my job is putting together a very diverse group of surgeons, nurses, technicians from all over. We had the Asumi vessel from Japan that brought down numerous surgeons of very high level capacity. And from Japan, we have had folks from the Dutch, Netherlands surgical teams. We've had numerous host nation surgeons on board. And the potential issues of that, from setting up an OR, making sure we're doing the best thing for our patients, and also from safety and efficient surgical care. Well, what I can tell you is we all speak medical, we all speak surgical, and we're able to bring this team together extremely well under one roof because we all have that same mission in mind, and that is providing the best possible, compassionate, meaningful, high-impact care to our patients. But I guess what's more important to me is building a model of sustainment out here with our host nation countries and the collaborations, because the medical mindset and the medical teachings and education, there's a thirst for knowledge, and we all have it no matter what level of professional you are, if you're in the United States or a host nation country or a Japanese general surgeons. The recognition of a surgeon or a technician or provider when you learn a technique or learn a skill, and what I call that smile of recognition of learning that technique and that education is really important. It's not just the smiles on our patients' faces that Captain Hinman talked about, but it's the smiles on our surgeons and technicians and nurses that really play a huge role. And I love seeing that smile because they've now figured out a better way to take care of their patients in the future.
Thank you, doctors. I think we also have AP on the line. Eric, are you on the line?
Yeah, I am. Thanks. I feel a little bit sheepish, no pun intended, asking this question because I'm coming in very late on the call. But I wanted to ask Stephanie if just a couple questions. Hopefully you haven't already answered these. Was what kind of animals were you working with most, and what were the major concerns you're dealing with? And just about World Vets, has your organization had any involvement with dealing with the animal problems in Fukushima? Are you still involved in that at all?
No, we weren't involved with Japan. We were involved recently with flooding in Thailand. That was last year. That was a big disaster response that World Vets did do. The species that we've been working with, mostly cattle, water buffalo, a lot of pigs in all the countries, chickens and ducks are numerous, and also we're doing dogs, and in Vietnam and Cambodia some cats as well. The major problems really tend to be parasites and management and nutrition. The disease outbreaks are generally contained by the veterinarians in the field, and we didn't see very many really sick animals on this trip. Perhaps it was population selection for us, but that's mostly what we saw. And we didn't see any sheep on the whole trip.
Thank you, Doctor. I'm going to wrap this up with a final question for Lieutenant Hinde. I know that one of the genesis for the Pacific Partnership was the outpouring of goodwill and cooperation after the 2004 tsunami in the Indian Ocean. But I know that the overall mission has evolved to be beyond just disaster assistance and to look at engineering and infrastructural improvements in different countries. Lieutenant Hinde, can you speak to a little bit about some of the engineering projects that you've worked on and the capacity that's given to various countries?
Yes, certainly. Thank you. Look, every nation has got a different way of constructing a building, and what we have here is at least the partner nation, the U.S. engineers, the CDs, and the host nation. We all come together at each site and we construct this amazing building, may it be a classroom or a medical center. And I think seeing these engineers come together, sharing their experiences, sharing their cultural beliefs, and we spend a lot of time on the ground. We spend at least a month for some of us, and then 2 weeks further on in each other country. So we become part of this community, and the knowledge that is shared between us. Each building is constructed differently for a reason within each country, mainly because of the environmental factors. So we certainly have taken away a lot on how to construct these buildings and why.
Thank you, Lieutenant. I wanted to ask if we have any other questions this morning.
And Paul, I think if there's... Oh, go ahead.
Oh, sorry. I just wanted to say thank you. That was all for me. Over.
Paul, if possible, I think the mission commander might want to just add a couple things.
Absolutely. And when we finish, we're going to post the entire interview for folks to have. It'll be the audio of the entire interview. So feel free to push that out to anybody you want to. And those of you on the line, feel free to access that as an on-the-record document. Thank you. Commander, if you have anything else. Captain Morgan?
Well, once again, I want to thank you for hosting this roundtable. And my closing comments, I refer to Pacific Partnership as a whole-of-government approach to a mission. It's one of the few missions where we have partner nations, host nations, NGOs, and the military, and all coming together with one purpose, again, which is to build capacity and build the relationships that we need to respond to a disaster situation, again, not if or when it occurs. We talked a lot about World Vets as a great example of an NGO who really provides a lot of capacity to the mission for the simple reason that we just don't have a lot of veterinarians within our own military. So to do that part of the mission, our NGOs provide a critical capacity above and beyond what we can provide. So again, I echo back to my experiences in Japan last year, where the relationships we built with the government of Japan, military of Japan, over about a 70-year period are what actually were the foundation of our ability to respond to that natural disaster. And I think that's what this mission is really about, is to build the relationships in peace in a time of planning and calm, so that when the natural disaster ever does occur, that we aren't strangers. We have worked together in the past, and then we'll work together when we have to ease human suffering. So those are my closing comments about the overarching themes that I have with Pacific Partnership and the wonderful mission it is when it brings so many host nations, partner nations, NGOs, and military members together with a focused effort looking towards the future. And I think we're all looking forward to future missions like this so that we can continue to build on what we've done in the past. Thanks.
Captain Morgan, thank you, and thank you to all that participated in the call today. We'll conclude the call at this time, but as I said, we will be pushing out the audio file for everyone to use at their discretion. Thank you very much, and have a good day.